Thank you, Anja. Yeah, moving on to some results from the impact assessment, which was also one of the activities we have performed in our work package 3. The goal was to assess the impact of the project's output, namely the deliverables. For that, we have asked experts who participated to the stakeholder consultation to also participate in interviews. Thankfully, the national contact points of the project helped us to find the right partners. So overall, 18 semi-structured interviews were conducted between November 2025, February 2026, with experts from 8 countries, ranging from clinical experts, clinicians, to vendors, to health insurers. So what was also asked was, based on this interview guideline, what would be the barriers that needed to be overcome for the project deliverers to have a lasting impact. And what was most often cited was the divergent national coding systems, especially for the medicinal products, but also for the drug coding systems, where SNOMED sometimes is partially already in place and sometimes not. Vendors feared some compliance or high compliance efforts, especially for the small and medium-sized vendors. It was seen as a bigger issue. Also, workforce shortages were mentioned. And from the clinical side, we heard a lot about administrative burdens and fear of having a work overload if for example, the semantic workflow was not well integrated into the actual workflow. Yeah, governance and sustainability gaps were mentioned as the biggest concerns by the interviewees that needed to be addressed. And there was a wide consensus that there would be needed an authority for long-term semantic governance. It was seen as unsustainable that there is that we rely mostly on volunteer-based standard organizations, and the maintenance and versioning and evolution of the specification was seen as very important, of course. So let's come to the results. Overall, the evidence from those interviews suggested that the project delivers good foundation, a baseline for the future EHDS implementation. Of course, it's incomplete. I think Esther mentioned that there's still work to be done, and that we need to refine also on specifications and a lot of models that were developed within the project. We came up with some of the decisive determinants of success, which would be to establish a stable European semantic governance framework, also transitioning from the voluntary MyFEDU network to the mandatory infrastructure under EHDS, and is seen as one of the determinants of success. A clear migration and phasing strategy, meaning to having a stepwise approach instead of a big bang rollout towards the end of the implementation phase, meaning approximately 2029, was seen as favorable. Also sustainable tooling for validation, especially on semantics, was seen as necessary, and of course the continued funding for maintaining the different specification and technical foundations in order to provide or still continue with the high quality of the technical baselines. And of course, last but not least, transparent and iterative stakeholder engagement, where stakeholders' feedback would be incorporated and integrated into the outcomes in a transparent way. So absent those determinants, there was seen a substantial risk of the formal compliance. With them, the deliverers could significantly reduce fragmentation and strengthen the digital health ecosystem in Europe over the next decade. And now for the conclusion, or the overall conclusion of the work package, there was a very high stakeholder engagement, as we already heard, especially for the stakeholder consultation under work package 2. A lot of work was done. Still, there was a complex structure which required a significant amount of coordination and alignment effort, I guess. The Xt EHR project, it delivered the technical outputs that were foreseen, laid important groundwork for the future interoperability across Europe. Of course, the realization of the transformative impact, it will rely on the governance decisions and implementation support beyond the project's scope. Overall, the deliverables have the potential to make the significant contribution we all aim for, and to reducing the fragmentation across the European digital health landscape. So the message is here, yeah, we did a lot, but let's keep up the good work. Thank you very much.